Good morning. Good morning to you. I'm Dr. Philip Landrigan. I'm a pediatrician. I'm the chairman of the Department of Community and Preventive Medicine at Mount Sinai, and I also direct the Children's Environmental Health Center, which is a fairly new entity that we've established here at Mount Sinai within the past year, although it builds on programs that have looked at the interface between children and the environment that have been here at Mount Sinai for more than a decade. I'd like to begin by saying a few general words about the relationship of children to the environment in which they live. Our children are precious, but in today's world they're surrounded by chemicals, and we now know that children are very vulnerable to these chemicals, but we also know that we can take action. I'm going to talk about a couple of successful examples in a few minutes. We can take action to protect children against environmental hazards. So let me give you a very quick overview, though it's not the main topic of the day, give you a sense of the situation in which children today find themselves. Children are exposed today to a whole series of chemicals that didn't even exist a generation or two ago. The ones that really matter are the approximately 3,000 chemicals that EPA calls high production volume chemicals. These are the chemicals that are all around us in cosmetics, in foods, in building materials, pesticides. Some of these chemicals are very helpful. New antibiotics, new cancer treatment drugs, chemicals that disinfect drinking water. But the problem is not that we have chemicals, but rather that we've done a very poor job of testing these chemicals to ascertain whether or not they're toxic. So for about half of these high volume chemicals, we really don't have any information on toxicity. And then when it comes to the more specific question, what do we know about the impact that these chemicals might have on early childhood development? The answer is we have no information at all on about 80% of the chemicals, which is to say that every day our children, and that includes fetuses, infants, young children, are exposed to a whole suite of chemicals in their environment, and these chemicals are of simply unknown toxicity, which I consider to be an inherently risky business. And we know that these chemicals get into people's bodies. The Centers for Disease Control has done national surveys of blood and breast milk. Some of the environmental groups have done surveys of umbilical cord blood from infants, and we know that 80, 90, 100 chemicals are routinely detectable in blood, breast milk, and infant cord blood. The levels are low, but the chemicals are there, and their toxicity is not known. We know that children are vulnerable to these chemicals. They are more heavily exposed pound for pound. They're biologically more vulnerable. They don't have the ability to break the chemicals down and get rid of them. They, especially in early development, especially in fetal life and in the first couple of years after birth, there's a phenomenon that we pediatricians call windows of vulnerability, times of exquisite sensitivity. If a child is exposed to a toxic chemical at those points in time, for example, kids that were exposed to thalidomide in the 1950s, kids that were exposed to diethylstilbestrol in the 60s and 70s, terrible things can happen to the kids that have no counterpart in adult life, windows of vulnerability. And children have decades ahead of them. They have a long time in which to develop disease that may be triggered by early exposures. So it's to confront and deal with and find solution to these problems that we've established the Children's Environmental Health Center at Mount Sinai, and this is our mission, which is to protect children against environmental threats to health. And it's this center which is convening today's event. So with that said, as introduction, let me turn to the subject of lead. So lead is an ancient metal. It's an element, of course. It's abundant in certain regions of the world on the Earth's crust. Because it's malleable and easy to melt, humans have worked with lead for a long time. This is a statue that's in the British Museum that's 4,000 years old, obviously a human figurine. And back in ancient times, only a small subset of the population were exposed to lead, principally workers, people like underground miners. And so lead poisoning was known, it was described by Hippocrates, but it was thought to be a disease of workers. That's changed in the past century because the use of lead has skyrocketed. Lead is now used in a whole wide range of applications. The broadest exposure to the population has resulted from the use of lead in paint, and the addition from the 1930s till the 1980s of lead in gasoline, those two sources, paint and gasoline, led to very broad exposure of the American population to lead. And the result, therefore, was that lead poisoning moved beyond being a disease of workers to become a disease of the public. And these are some geochemical sampling data which shows you, extending from 800 BC till the late 20th century, shows the incredible skyrocketing distribution of lead in the environment that has occurred in the past century. There was almost no environmental contamination before the Christian era. There was this gradual increase during the Industrial Revolution, and then this incredible upsurge in the 20th century, which mainly reflected the addition of lead to gasoline and the distribution of that lead through the environment. The result, then, is that people like children have come to be exposed to lead. In childhood lead poisoning, a disease that was first recognized in the early 20th century down in Australia. And the children who were first recognized were very terribly sick. They had eaten lead paint chips on these painted verandas in northern Australia. They had coma. They went into convulsions. Some of them died, but others recovered. And it was thought to be an acute disease, a high-dose disease, and that was the beginning and the end of it. But then, in the last few decades, we've learned that those cases of acute lead poisoning are just the tip of the iceberg, that for every child who's acutely and obviously ill, who has clinical symptoms, there are tens, hundreds, even thousands of children who have elevated lead levels but no symptoms. In other words, they have too much lead in their body. That lead is causing injury to various organs, but the levels are not high enough to produce symptoms. It is, however, possible to detect effects on special testing. As soon as we do IQ testing, as soon as we do testing of a child's ability to focus or maintain an attention span, the damage becomes evident. So this is acute lead poisoning. This is subclinical lead poisoning. And we've come to learn that if a toxin like lead is widespread in society, the way lead was in this country in the 1960s and 1970s, it can have very widespread effects on the health of children. So this is a bit of a complex graph, but it's important, and I'd like to take a minute to walk you through it. What it shows is the impact that lead exposure in the 1970s had on intelligence in the American population. So if you have a population that's unexposed to a toxic chemical like lead, the IQ score, the measure of intelligence, the scale goes from 0 to 200, the mean and the median are at 100, and 6% of children have IQs above 130, and 6% of children have IQs below 70. That's the normal situation in most parts of the United States, except like Wobegon, where it's all a little bit better. Now what happens if you put something like lead and you put it out widely in society, which we did in this country a couple of decades ago? You depress the average IQ by 5 points, which doesn't sound like very much, 5 points on a scale of 200. But the problem is that when you look at the two tails of the curve, you can see that the effects are quite profound. So at the top end, the number of gifted children is reduced by more than half, which is certainly not good for the health of society. It means that we're decapitating the future leadership of the society. It means we're depressing the people who are going to be tomorrow's doctors, tomorrow's business leaders, tomorrow's lawyers, the people who are going to be most economically productive. And at the same time, we're increasing by more than 50% the number of children who are going to need special care, who are never going to achieve their full potential. And that imposes very substantial burdens, economic as well as emotional, upon our society. That's why it's important not to allow the population to be exposed to chemicals that damage the developing brain.